So Rick had asked me a couple weeks ago to talk about in vitro fertilization and what's been happening in Alabama. And I thought, well, that was a good place to start. And then we could also talk about a little bit about abortion rights and even contraception. And I'd like to start by just acknowledging that as I speak today, I absolutely know about and support gender diversity. But just for clarity and conciseness, when I talk about pregnant people, I'm going to say women. Just makes it clearer. So in vitro fertilization, IVF, it accounts for about 2% of all births in the United States these days. So this is not a rare situation. It was originally developed because of women who had tubal issues, but now it's used for all sorts of different reasons. It's used for unexplained infertility. It's used for sperm issues. It's used for recurring miscarriages. It can even be used. It can be used for same-sex couples. It can even be used for couples where there's a risk of a deleterious genetic condition. And I'll tell you that the sort of usual process for in vitro, a woman will undergo what they call stimulation. She gets hormones so that instead of just making one egg a month like most women would do, she makes, say, 20. And then those 20 eggs are harvested and fertilized with sperm. And now they don't all take, but say you've got 12 embryos now. And then at that point, depending on what you're doing it for, you might actually put all of those, freeze all of those embryos, or you might insert maybe just one or two. So in a typical IVF cycle, it is not unusual at all to generate 10 frozen embryos. So this issue of frozen embryos and what happens with them is very much a current problem. I have seen estimates that there's about 1 million frozen embryos in the United States. So this is much more than just a hypothetical, really rare kind of situation. Alabama has decided that there is such a thing as fetal personhood. And they have defined that as applying to all unborn children, regardless of their location. So they have unilaterally declared that these frozen embryos are people. Do they know what this means? Not really. There's so many questions about what are their benefits? Should they start collecting Social Security? Can you get child support for them? What does it mean when in vitro, if a mother has gotten pregnant and she's happy with her family size and she has leftovers, what is it? Does she have to keep those frozen forever? Can she, ever discard them? The ones that may carry genetic abnormalities? Can you, in good conscience, get rid of them because they're people? No. So there's an awful lot of questions. That's why in vitro got put on hold in Alabama. And they're trying to pass some new legislation to try and solve some of these problems, but not surprisingly, the government doesn't usually solve anything medical, and there's still many more questions than answers at this stage. Alabama's been doing this fetal personhood thing for a while, and they've also used it to affect women who are already pregnant. At least 600 women in the state of Alabama have been jailed because of what they call chemical endangerment. So a woman may take a medication, even if it's prescribed by her doctor, say a narcotic, or if she's smoking some marijuana. They have put these women in jail, sometimes for the duration of their pregnancy, to protect that unborn fetus, never mind the mother's rights. And recently there was a case of a woman who was jailed for pretty much her entire pregnancy. And while they were so concerned about her not endangering her pregnancy, they left her untreated, unmonitored while she gave birth in the shower. They did give her some Tylenol for the pain. So we know that their concerns are much, much more for the fetus than ever for the mother. And then, of course, we can see how fetal personhood then comes over into the area of abortion. And as we know, ever since Roe got overturned last year, States have been very aggressive about restricting or banning, they don't like that word, but banning abortion. And we know that the Republican presidential candidate has very much said that he wants to have a 16-week ban. This is affecting OBGYNs so much that as part of my continuing medical education last year, I had to read a whole article about how to help women who have been self-managing their abortions. And one of the biggest points that they made was, just don't ask her, because if you don't ask, then you won't know, and then the cops can't come and ask you what started this miscarriage or abortion. That's very helpful advice as we're trying to take care of people. So medical abortion consists of about more than half the abortions that are done in the country these days. And it's actually, we hear about the abortion pill. There's actually 2 drugs involved, but the one that has more controversy is, they call it mifepristone, or Miffy for short. This drug was approved by the FDA back in 2000. And yet there's a lawsuit currently working its way to the Supreme Court that says that it was rushed into approval and that it should have never been approved. And despite 24 years of use in the United States since that approval, that it should definitely be taken off the market. This is also used, about 16% of terminations in the United States are now done by telehealth. And of course, if mifepristone is gone, that won't be an option. And there's also the Comstock Act, which is a very old act dating back to the 19th century, that was originally used to prevent the spread of information about contraception. Well, if you can use that to stop the mailing of the drugs, then you can stop a lot of this telehealth as well. Sorry. So this is very much affecting women's health care. There was recently a poll of women, of OBGYNs in anti-choice states. They said, do you know anybody, or have you yourself had cases where this current laws are affecting patient care? 93% of them said yes, that either they themselves or they knew people who had taken care of patients who were not able to practice the standard of care because of these laws. So these are the women that you're hearing about who are having septic abortions and they can't have terminations, who are having ectopic pregnancies and they can't have terminations. So very much it is affecting women's health care. In the state of Idaho, it's a small state, 227 OBGYNs in the entire state. 51 of them have left the state since Roe overturned. 2 moved into the state. So that works out, sure. It's worsening the case of what they call maternity deserts. There are giant swaths in the United States where there are no OBGYNs to deliver babies. The United States has terribly high maternal morbidity and mortality compared to other comparable countries. This is only going to get worse. And just to give you an idea of some more numbers, in the Journal of American Medical Association, they just estimated that since Roe was overturned, there have been 65,000 rape-related pregnancies in the anti-choice states. Now, not all of those would have ended in termination, but you think about how many women are affected. It's appalling. About a year ago, I talked about a case in Ireland that really changed that country's feelings about abortion. It was a case of a dentist, Dr. Savita Halappanavar, who had died of complications after her septic abortion was not taken care of. And we're sort of waiting to have that case here in the United States. We've heard about women who have had to go to extraordinary measures, like Katie Cox, who had a baby with a life-threatening, not compatible with life issue, had to leave her state despite her trying to sue to get the abortion locally. We heard about Brittany Watts, a young woman in Ohio who had ruptured membranes, begged the hospital to help her finish this pregnancy that was not viable. They sent her home because they said there was nothing she could do. She miscarried at home, and they had arrested her for desecration of a corpse. Part of the reason why we're not hearing that name yet is because of cases like the 10-year-old who had gotten pregnant and had to leave her state to have the abortion. And then the doctor who did that abortion followed every rule, was a completely legal thing, was absolutely harassed for an entire year by the state attorney general in the state that she practiced for having done what was appropriate. So doctors are afraid. Doctors don't want to be the one who comes out, because if you come out and say, here's the case, you know darn well they're going to nitpick every single detail and make the doctor look like the bad guy. And you say, well, wait, there's exceptions. There's exceptions for maternal morbidity and there's exceptions for rape and incest. Well, those exceptions are almost never used because, for instance, for the rape, it has to be reported. It has to be reported with a certain number of days. It has to be, one state even says it has to be believable. As far as the maternal risk of maternal death, same thing. Define it. Medicine is an art, not a science. There is no, this is the point where she's going to die, and this is the point where she's going to be safe. And Texas, for instance, has said, well, you know, the courts can decide it later. Well, if a doctor's looking at losing their livelihood, losing time in jail, losing enormous fines, it's understandable why they're afraid. They're consulting the hospital attorneys in the middle of the night as the patient's hemorrhaging. And the hospital attorneys are saying, well, we don't know. You know, is it legal to help that patient get out of the state to get the care that she needs? Maybe not in some of these states. One of the latest things that's happening with this is in the anti-choice states, they're talking about not babies with lethal abnormalities, not non-viable pregnancies. They're calling them babies with disabilities. So who can be, you know, of course you wouldn't want to just abort a baby with a disability. We're talking about babies who have no heads. We're talking about babies that cannot live, but the choice of words is so important. And this is leading toward now the next step. How do we cut down on women wanting to have abortions even more? If you can eliminate prenatal testing. So they're trying to, just the same way they're going after mifepristone, they're going after genetic testing. Because if you can say, oh, that's not reliable, oh, you don't know that that's going to be a problem, then, you know, there's no reason. You can just carry that pregnancy for 9 months and you get what you get. Why does this have to do? I said I wanted to talk about contraception briefly. When I was here, I think it was a couple of weeks ago, I noticed that a speaker talked about the morning after pill and the abortion pill as being the same thing, and they're not. They're very different drugs. They're very different things. But I think the other side is trying very much to get us to confuse those two things. Because, okay, now if we are going to ban the abortion pill, then maybe we're going to ban the morning after pill too. There's actually more than one kind of emergency contraception, but emergency contraception does not cause abortions. If you are already pregnant, you cannot terminate a pregnancy with the over-the-counter emergency contraception that is available. It doesn't work that way. But it's part of this gradual chipping away at women's rights, gradual chipping away at contraception. We're going to lose the emergency contraception because it causes abortions, which it doesn't. We're going to lose IUDs. The Hobby Lobby already came to court saying that causes abortions, so they could not use that. And then there's a big push toward, well, the birth control pill. Well, that's very, very dangerous. We don't want women to, you know, risk their lives by using contraception. So that's kind of the trend, is we're just going further and further away from women's rights. So, you know, what is the goal from the other side is really to limit women's rights. What can we do about that? We're going to vote, and we're going to vote hard. And I think staying informed and keeping, you know, up to date on what's going on. I can tell you that every state, every anti-choice state has, it seems like, hundreds of bills coming through. And of course, most bills don't become law. But it is terrifying how many bills you can read about practically every day. Just the same as the anti-LGBTQ legislation just keeps churning. There's so much going on in these same states. I have to say that I'm going to give a shout out to TikTok, because as far as the most up-to-date reasonably quick information, that really has been a wonderful source for me. So, I hate to think about losing the ability to quickly disseminate information like this. So I thank you for your talk. I think, Jeremy, your talk about health, about life and valuing life was very, very pertinent. So thank you for that.